Hi, I'm Dr. Matei. I am a specialist in hospital-based palliative medicine, and in that role, my team and I see people that are very sick in the ICU, often can't speak for themselves, so we're looking for who's going to be the decision maker for this patient, and sometimes it leads to difficult situations. So I have a little story to illustrate our dilemma that we face sometimes. So here we have a 50-year-old woman who is divorced and has two children aged 19 and 17. She is involved in an accident. And she winds up sad and on a ventilator in an ICU, not able to speak for herself. So now we're looking at who's going to be her decision maker, who's going to sign consent for her. So it comes down to, we have, who could it be? It'd be the multiple choice question here. You have the 17-year-old son, you have perhaps the patient's sister, her 19-year-old son, her ex-spouse, or her mother, the grandmother to the children. So based on the defaults in Texas at least, if there's nothing in writing, it would come down to the 19-year-old. He would be consent, and he would be the default surrogate decision maker. That sounds very harsh, but that's what happens. And these decisions sometimes are difficult. These are decisions that the family remember forever, such as we had to have surgery. Even the most difficult decision is it time to withdraw life support and allow natural death? So that's a difficult discussion to have with a 19 or 20-year-old. We have had them, and we hate doing that. Certainly the rest of the family is going to be around and support, probably be a family decision, but those boys are going to be faced with that, and it would be better if we can say, you know, it's the sister that made the decision, or the mother. So at the time of divorce, she could have designated a medical power of attorney, and then it would be a set agreement in much easier setting. So in the state of Texas, at least, the default, this is what we use. This is how things go. You have a court-appointed guardian, and this is usually someone that has perhaps some cognitive delay or cognitive disability, and they have the court has taken them over as a ward. That's uncommon. Next would be medical power of attorney in writing. Next would be the spouse. Next would be majority of adult children. Next, parents. Next, just any nearest living relative. And then if none of that is available, then we use clergy proxy and possibly have to call ethics to make the more difficult decisions. So as you can see in this setting, she's divorced, so it would fall down to the children, and that would be the 19-year-old as the adult child. In this setting where there's more than two options, such as children or nearest living relative, it would be majority of readily available. So if someone is offshore or in prison and they don't have access to the phone, they would be considered not readily available. So in the broader spectrum of things, looking at advanced directives is also a discussion of, with your family, what kind of quality of life is important to you. So you're designating, you say, I want you to be my medical power of attorney, and this is what's important to me. I'm okay being in a wheelchair as long as I can interact with my family. I'm okay getting nutrition from a feeding tube. I don't want feeding tubes. I'm okay being on a ventilator, maybe for a few days just to see how things go, but I don't want to stay on a ventilator for very long. So that discussion makes it easier in these difficult ICU settings. So that pretty much covers that, and thanks for listening.